Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hello there, ladies and gentlemen. Great to have you on our show today. We're expecting lots of callers, and if you want to be one of them, give us a buzz right now at the studio. That's 866-870-5752. That's 866-870-5752. You can talk to me live, Dr. Marc Darrow. I would love to hear from you. And you can have all of your questions on orthopedic pain answered by me. We do regenerative medicine. That's Dr. Grove and I. Dr. Grove is doing most of the injections these days. I've been doing this work for over 27 years. I was trained at UCLA, and I loved the work. It healed me when I was a young man, and I still get injured. I still run around like crazy. I'm going to go play golf later today, and I'm not happy unless I hit the ball far. And what does that do to my body? You can guess. Also, whatever I do, I like to do hard. I was a gymnast when I was young, and I'm used to having the body stressed, and I really enjoy sports, always have. I remember as a little boy, I ran everywhere. I didn't walk. I just always loved getting around like that. It looks like we have a caller coming in soon, Peter, so hang with us there, Peter, and I'll get to you in a minute. The other things to tell you are that if you give me a call now, I'm going to send you a copy of my book. It's Stem Cell and Platelet Therapy, Regenerate, Don't Operate. What that means is we inject stem cells and PRP, platelet-rich plasma cells from the blood, and we can inject those in the areas where you're having all kinds of issues, anything from sometimes even headaches. Sometimes it's back of the neck that there's some ligament laxity or something like that that's referring into the head. But all the way from the head, neck, all the vertebrae in the spine, the ribs, all the joints, the shoulders, labral tears, rotator cuff tears, finger arthritis, big one, really a big one for people. You name it, we've got it that we take care of. Toe pain, ankle pain, knee pain, meniscal tears, hip labral tears, joint arthritis. I can go on and on and on and on, all the syndromes that people get. And we can heal that by just simple injections. You walk in the office. You don't need a driver. We don't give you anesthesia. You don't need it. We use small needles. And I'm gonna take a break right here from just vamping, whatever they call it on the radio, and go to Peter. So, Peter, can you hear me? This is Dr. Marc Darrow. Is this Peter or Monica? It's about Monica. Okay. Hi, Monica. So the question here is help with bone marrow issues. Tell me what the issue is that you're experiencing.
Well, I have severe left hip pain. I'm a registered nurse and on my feet all the time. But I'm just actually pulling up the results of my last MRI.
Beautiful. Let's hear it.
Okay, hold on. I'm trying to open it. I have, hold on, here it comes. I have medius left All right. I have gluteus minimus and medius insertional tendonitis with associated cortical irregularity, subtle narrow edema, and sub-centimeter trochanteric bursitis.
Okay.
And a lot of pain.
You're in good shape. You're in good shape. You're in a lot of pain, but I'm telling you right now, you're in good shape. And these are the kind of things that we have to... Yeah. You're in good shape. So listen for a minute, and then you can ask me some questions, because I have a lot of information to give you that's going to make you happy. The things you have don't count, okay? They don't count because you don't need surgery. And the big horse, the big white horse that Dr. Grove and I ride on, is saving people from surgeries. So you need to really be careful, because you're a nurse, you're around surgeons all the time, you're going to talk about your pain, and they're going to tell you that you need a hip replacement. That's very possible. I don't know what they're going to tell you for sure, but it happens all the time where we have people who come in and they've been told they need a hip surgery when what's going on with you has zero to do with your hip. Do you understand what I just said?
Yes.
Okay, good. Did you know that?
No.
Okay, good. Then I've already done what I can do to help for this show today. I've already done the miracle. So what I want you to do is take the phone number of my office, which is 800-300-9300. The office number is 800-300-9300, and I want you to call there right now. We have people at the office today, and I want you to come in, and in about 1 minute, when I examine you, I'm going to show you why this has zero to do with your hip joint. Do not get a surgery for any of these things. You have what I'm going to call a sprained ankle in your hip.
Oh,
you don't get surgery on a sprained ankle. Do you understand what I'm saying?
Yes.
Do you get me? Okay, good. Then I've done my job today.
Oh my goodness! I can't thank you enough. 800-300-9300.
That is the number to my office. Yes, so you call there now. And if you like, you can go to my website, stemcellinstitute.com, and watch videos of what we do for what you have. You have nothing. It's just a sprain of two muscles that attach to the hip bone. Not really the hip, it's the pelvis. The hip is something distinct. It's the joint. So I misspoke myself. It's the pelvic bone in the back, and then on the side there's a lump on the femur called the trochanter. You have tendonitis there, bursitis. You have nothing, okay?
Doctor, I also had an MRI with contrast that showed a small labrum tear.
It means nothing. Labrum is the lip. In Latin, it's the lip around the joints. And you don't get surgery for that. Those surgeries come out terrible. And get into the office. I'll get you in Monday morning if you want, whenever you want. And we'll talk. And I'll show you that this is not a surgical issue.
Thank you so very much. I can't.
God bless you. Thank you, Monica.
Oh, thank you. Likewise. God bless you.
All right. God bless you.
Bye-bye.
All right. We're going to go to Matt. Matt, are you ready? Yeah, you're ready. Matt called to tell his story. What is your story, Matt? Hello? Matt's still there. Yeah, Matt. Hi, Dr. Marc Darrow. How are you?
Hey, I'm good. How you doing, Doc?
Good. You got to talk fast because we got a whole board full of callers. What happened to you?
Oh, I just wanted to quickly tell my healing story.
Okay. Tell it quickly.
So I had suffered for several years with elbow tendonitis, golfer's elbow, if you will, from lifting weights and playing golf and getting tendonitis flare-ups and not letting them really subside sufficiently, and kept getting cortisone shots for short-term Band-Aids for the pain, and the cortisone shots were shorter and shorter.
How many cortisone shots did you take?
I probably had 4 over the course of 2 years.
Okay, so I want to let you know this right now. Don't ever do that again. that destroys that little tendon, the extensor tendon that goes to your elbow. So that's the worst thing anything can do. It's the worst thing doctors can do to people. I don't know why they do it. They do it to shut them up and get them out of the office instead of heal them. So how are you today?
Oh, after a couple treatments with you, I am doing much better. Progressing.
Wait, are you Matt from Chicago? Are you the guy from Chicago that flew in for?
Yeah.
Aha! Yeah, you're a cool guy, dude. Thanks for calling in. Appreciate it. Yeah, I remember you had. You had one set of stem cell injections. You flew back to Chicago, and then you kind of beat up your elbow again. It got better, but it was a little beat up, so you came back again, right? You did
That's
some
correct.
things to it that you shouldn't have done. And then how is it doing now?
Oh, it's doing great. I'm progressing nicely. I'm being methodical, but everything is feeling great. I'm excited about the progress.
Ah, beautiful, beautiful. I love that. Anyway, I'm very, very happy. So yours is the story that everybody should hear. When you get stem cells or platelets, you need to rest the area, not let anybody beat it up. Don't do that exercise that we all want to do right away. Or sometimes physical therapy is not a good thing for it. It's best to let these cells grow. And I know that you were doing better, and then something happened, and it reverted a little bit. But you came back, you flew back to L.A. from Chicago, and your elbow is all better now. So have you played golf yet? I remember you were a golfer.
Yeah, I have not, but I've been slowly working up to it. I'm going to go to the range and hit some balls today. I'm very excited about it.
Excellent, excellent, excellent. From what I remember, I think you went to the range already, right? You were chipping, or I forget.
Yeah, I've been slowly progressing up. I'm going to be hitting some mid-irons today and seeing how it goes.
Cool.
And so far, everything's been great.
All right. Try to stick with no more than an 8-iron today.
You got it. That's the plan.
Half swings. Yeah. All right. God bless you, Matt. I appreciate your story. It's another wonderful story of how, stem cells and PRP can really help heal things that many people get surgery for. And I've seen these surgeries on the elbows that come out horrible. They scrape off the tendon, put it back on, sew it back on. I don't know why anyone would do that. I don't know why anyone would do surgery when you don't need it, but that's me. Anyway, God bless you, Matt.
I agree. You got it. God bless you.
Okay, so thank you. We're going to go to Joe, who's got a torn muscle question. Joe, go for it. Can you hear me? Well, we'll skip Joe till that's ready and go to Jason. Jason, are you... There you go. Jason,
Yes.
Dr. Marc Darrow.
Hey, Mark, how are you?
What's up with you?
I just wanted to share my story, with the listeners.
Okay, go for it.
So, basically I was diagnosed with scoliosis as a child, wore a heel lift, didn't really help me. So I just kind of learned to live with the, discomfort. But what really happened to me was in my 30s, I took up snowboarding.
I assume you're saying that with scoliosis, you think, or you thought the scoliosis was causing back pain. Would that be the case?
Yes, I just figured, it would, I would get discomfort from standing, in one position too long, and I just, assumed it was the scoliosis that was causing my back pain. And because that was
scoliosis doesn't, by the way, just for everybody listening, scoliosis doesn't usually cause pain unless it's very severe.
Yeah, my deviation wasn't that severe. I think I have 2 deviations, about a half inch, each. But
probably not the cause of your pain. Yeah, but anyway, what happened to you, and what's going on now?
Yeah, so ultimately I took up snowboarding in my 30s, had a snowboarding accident, I couldn't stop, hit a snowbank. I was sore, for a few days, as you can imagine. I assumed it wasn't anything serious, but it gradually got worse and worse and worse, my back pain. it got to a point where I couldn't do my walks anymore, and I used to walk, 3 miles a day. I couldn't even stand, and I moved to
So the big question is, great story, how are you doing today?
Well, today, doing much, much better. I basically got the PRP treatment, and within the first few sessions, I immediately felt relief, and I literally went from not being able to walk more than 2 feet to now being able to walk again. And
so I'm gonna ask a question, Jason, and I hope the answer is yes. Are you one of our patients?
Yes, I am.
Okay, good. I didn't want to advertise for another doctor, but that's great.
No. And actually, I come in, for maintenance care, so to speak, every so often if I feel I need it.
Yeah.
If it weren't for the treatment, and I was referred to, you, Dr. Darrow Wellness, from a neighbor of mine years ago.
Okay.
And if it wasn't for that, I'd literally be in a wheelchair because I could not walk more than 2 feet. Yeah. It was horrible.
All right, Jason, well, listen, we have a whole bunch of callers.
Yeah.
I really appreciate hearing your story, and everybody else does also. Yeah, low backs are one of the biggest areas. Knees are probably number 1, shoulders number 2, backs are number 3. But we do the whole body. Dr. Grove and I inject every millimeter of the body. So regenerative medicine, regrows tissue anywhere. And I'm so glad you didn't consider getting a surgery for scoliosis because that's not your problem. All right, so I'm going to give out the phone number to our to the studio in case anybody wants to call and talk to me live. We've got Joe waiting, we've got Doug waiting, we've got Michael and Jenny. So I'm going to be quick about this. The number to the studio is 866-870-5752, 866-870-5752. And the number to my office, if you want to talk to my staff and get a free phone consult and a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with a foreword by Suzanne Summers. It's a couple hundred pages long with 256 scientific studies on how stem cells work and heal and save people from getting surgery, which is really the most important thing that I think we can do. So let's go to Michael next. Michael, are you there?
Hello.
Can't hear you, Michael. You're in a tunnel.
Hey, Dr. Darrow, how are you?
I'm good, but we still can't hear you.
You can't hear me? Hold on. How's that better?
Oh, yeah.
It's better.
High tech is not always the best thing.
I know. That's true.
So what's your...
How are you?
We got to have you talk quick and get you off because we've got about 5 more people waiting to talk. So who are you? What's going on? And what can we do to help you? What's your question?
Well, I just wanted to call to tell you, the listeners and you about just how great my results have been with stem cell treatment. And,
what happened to you?
Well, I've been to see you several times, as you know, and
I don't know because I don't know who you are. I'm sorry. I apologize. Yes, Michael Boyer is a chiropractor in the desert. I do know you.
Acupuncturist.
You've done very well.
Right.
Yeah, I think I've done both your shoulders, correct?
Both shoulders and my lower back. And
okay.
I mean, I could tell the story about my lower back because I just had a really unstable vertebra, and it was always going out.
Okay.
And,
and by the way, I apologize for calling you a chiropractor since you are an acupuncturist.
Okay.
Do me a favor, Michael. Give out your phone number so people can get a hold of you because you are amazing also.
Oh, sure. It's Palm Springs. I'm in Palm Springs, so it's Palm Springs Acupuncture Center, and it's 760-327-2287.
Cool. So I assume that the work we did on you has made you better. Did you have rotator cuff tears in your shoulder?
I had several torn rotator cuffs in both shoulders.
Okay. And how are you doing now? Are you able to work out, do all the things you like?
Yeah, everything is completely healed. I mean,
Wonderful.
And all I needed was really one stem cell treatment in my left shoulder and a couple of them in my right shoulder, and those were at different times. And also I had a lot of laxity in my right shoulder because I had dislocated it many years earlier.
Okay.
And
yeah.
That's all.
This is also something to tell people. Very often patients get a surgery called a capsular reduction, where the capsule around the shoulder is heated up or cut and tied up to tighten up the shoulder so that the joint doesn't dislocate. That's a horrible thing to do in my book, my humble opinion, because it takes out range of motion. So yeah, it tightens it up, but the range of motion isn't as good afterwards often. And what we do is very simple. We just inject with stem cells around the rotator cuff and all the supporting areas and tighten it up that way. It's very simple, just getting simple injections. Walk in, get injected, and walk out. So, yep. Michael, God bless you. I appreciate your call. And we are going to go on, and you have a wonderful day. Go play tennis or something with the shoulders that are working.
Have a good day.
All right. God bless, man. Appreciate it. So I'm going to go to, let's see, who should we go to here? Joe. Joe got disconnected. Are you back with us, Joe?
Hello?
Hello, Joe. We can't hear you.
Hello? How about now?
Joe, we can't. Yeah, it's not great, but go ahead. Are you in the car or something? Okay.
Yeah, I'm in the car.
Okay. What's your situation? Are you having pain right now?
I'm not in pain, but I can't lift my right arm past level with the ground, 90 degrees. And I had
an MRI. Wait, hang on. What is your age? How old are you?
I am 67.
Okay. And you had an MRI. And what did the MRI say?
So the orthopedic told me that all 4 of my rotator cuff muscles were torn and atrophied. Okay. Telling him that it was an old injury. So my question is, would it restore the torn and atrophied muscles, the PRP therapy?
That's a great question. I don't have the answer. The reason is because I'd have to examine you and see what's going on. You may have what's called a frozen shoulder, okay? Do you ever hear of that?
Okay.
Or adhesive capsulitis. Adhesive capsulitis is the medical term. And it may not be those tears in your shoulder that are causing your problem, okay? And the reason I'm saying that is because I have 2 rotator cuff tears in my right shoulder, and I have a labral tear in my right shoulder. I have 0 pain, and I have full range of motion. Don't let the diagnosis lead you toward a surgery you don't need. You need to be examined by a doctor who does stem cells like myself or Dr. Grove and see what's really going on. We call it the pathology versus the reality. Your pathology is you have 4 rotator cuff tears. The reality is that you may not have, that may not be the problem. So you need some guy in there taking a look who's not going to cut you. All right?
Right.
Back in the day when Dr. Grove and I did the surgeries, we looked at the images and said, that's your problem. Since then, we have learned that is usually not the problem. And most diagnoses that come in are the wrong cause of the issue. So, Joe, I'm going to give you the number to my office. Write this down. It's 800-300. It's 800-300-9300. 800-300-9300. You can call there right now. There's people there. And try to get yourself in as quick as you can. We'll do a quick exam. We'll be able to tell you literally in 2 minutes what's going on. We're going to use the ultrasound to look inside and see what those tears are and see how big they are and see if they are the problem or not. You got that as clear information? All right, Joe, God bless you. I appreciate your call.
Okay. Thank you so much.
We got 30 seconds left till the break, so I'm going to give out the Stem Cell Institute website for people to look at. and see videos of us doing these injections, see if it's something you'd like to do. The phone number to the office, if you want to get a free phone consult with our staff, is 800-300-9300. And if you want to call the studio and talk to me live right now or in the next half hour, we're going to take a break, and then we're going to go to the next half hour. That's 866-870-5752 to talk to me live. All you folks that are waiting to talk to me, I hope you stay on. If not, you can call back in 5 minutes or so, 4 minutes maybe, after the break. And I would love to talk to you and hear what issues are bothering you. And let's help you get them resolved with stem cells or PRP instead of surgery that you don't need.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Stem Cell Institute in West Los Angeles. To schedule an appointment, call 800-300-9300. That's 800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment.